Hello there, my name is Kevin Durjun of TCM Academy. In today's Sharing the Wisdom, I'm so pleased to meet oncologist Dr. Julia Hartung. Dr. Hartung specialises in haematology and oncology, and she's undertaken further education in Chinese medicine, and she sees the potential of combining Chinese medicine with Western oncology. Welcome, Dr. Julia Hartung.
Hello, Kevin. I'm very happy to be here and talk about a thing which is coming from my heart, which is really, really important for me and for our patients.
Thank you. Now, I am fascinated to hear why an oncologist decided that they wanted to study Chinese medicine. What got you interested in studying Chinese medicine?
It's actually quite interesting for myself too. I was working as a doctor in a center for oncology in Western Germany. And at that time, oncology turned more and more into the processes of the malign cell into the cell, getting very, very microscopic. And I got more and more the feeling that I actually was missing something. The view on everything. I was too much into the cell. And I decided I had to do something totally different and choose to do a class for acupuncture and Chinese medicine. And that was really, really interesting. The first day in class, I knew that is it. That's what I need to get a holistic view on the patient. And at that time, I didn't even know how much I will get from Chinese medicine. And I'm very, very happy and lucky about this situation.
How wonderful to have that feeling of coming home.
Yeah, absolutely. I just knew it. That's it,
Um,
without a doubt.
Now, as an oncologist, could you describe the ways that you have seen within your own patients, you've seen how acupuncture can help them?
It can help on a lot of levels, actually. And it's good to remember all the principle of Chinese medicine when we meet cancer patients, because that's our strength. And there are two kind of very important things. Or I will start differently. We start and help patients from the diagnosis on, even in the process of the diagnosis. We can help people because that's a time of patients where the Shen is definitely disturbed. So if we can just meet people already then, we can help a lot on this level. And then it comes to surgery and chemotherapy or radiotherapy, and at each point of the treatment we're able to help. And again, we can help on a very body symptoms level, like hiccups and nausea or pain, things like that, like using pericardium 6 against nausea. And you can give it to patients and teach them to kind of put an in-seat needle on that point themselves, which is important for patients to get active themselves. So a very symptomatic thing using pericardium 6. But on the other hand, and that's one of the most important points I see, we can treat on Shen level. Because most of the patients have a disturbed Shen to some extent. And right now I'm seeing a very young lady in her beginning 30s having a really bad adrenal carcinoma, which is metastasized. And she's still in the process of surgery and deciding if she needs chemotherapy. And she can hardly talk to me when she comes into clinic. So I do acupuncture, and she is, for a moment in this really hard time, able to let go and to kind of find some kind of peace. And we shouldn't always concentrate only on symptoms. We should remember our big toolbox and bring it to the patient. And patients are so thankful about it. So just take your toolbox and use it. And has so many things to give us and the patient.
One of my friends had cancer a few years ago, and she felt that going to see her acupuncturist helped to keep her sane during the time of extreme stress. It was an opportunity for her to sit with a friendly person, a constant person, and to talk about her experience, and just to feel a little bit better, a little bit held for a period of time. She couldn't have done it without it.
Yeah. So symptoms are very important, and people need it within treatment. But the big gift in Chinese medicine is that we have the other level too. Without people or patients always, they're tired of talking at some point. And we just put them on the what do you say, the
couch.
The couch, and then you use a few needles, and they find a level which they have hard times to find in their life at that time of their treatment. So very important.
Do you have some favorite points that you go to that you find particularly effective?
I try to combine everything a bit. Pericardium 6 definitely is one of the important points. The stomach 36, as always, it's not only kind of, for me, strengthen the middle and the stomach and that kind of thing, but it has for me also a very important thing. Hannah Fruhauf talked about it once, that it makes people feeling at home again in their body. And so I like that point a lot. I do use a lot of treatments. I use points on the abdomen, like Ren6, Ren4, or 10 to 12 for abdominal discomfort, stomach 25. To bring them back to the center. And I do, perhaps not exactly after the treatment, but I use a lot of Shen active points for patients too. So it is a very kind of Jing treatment with the body and the symptoms, but I always try to include at least one point for the Shen. I try to use not too many needles actually with patients, because they're exhausted, and they probably just need a few needles to get things moving and feeling better.
Lovely. I'd love to hear about the attitudes of your oncology peers to acupuncture. How do they feel about you doing this additional work?
It has been changing in the last years. When I first started and I left the university where I worked as an oncologist, I got a few things. Oh, this is the wrong way you're taking, and it's stupid to do that. I got a lot of strange reactions from my doctors on teachings and why are you doing this? but especially the youngest doctors, younger doctors coming up, and I've been working in oncology now for over 25 years, and the younger doctors are more interested and they're more open to this kind of treatment. And we see more and more hospitals, especially university hospitals, which offer a program in complementary medicine. So people get more and more often, but you still have the hardliners who say, oh, okay. But it's getting more open, and people are more interested. Some kind of are jealous because I have so much more to offer than just giving chemotherapy. So I have the whole width of reactions, but it's getting more and more open towards this kind of treatments.
That's fabulous. That
Yeah,
is
it definitely
absolutely
is. It
fabulous.
definitely is.
Gosh. Now, I would like to hear your thoughts about what I can do as an individual acupuncture practitioner. What can I do to help integration of acupuncture into oncology services?
I think that one of the main keys doing that is that all of us need to understand the language of Western medicine. It's a totally different language. And it is important if you want to go to a clinic and you want to kind of try to integrate the thing, that they see that you know about oncology. So classes like Maimon, and where I also teach, we started this class for oncology acupuncture because we saw the need that non-doctors understand what oncology means. It's much easier to find a language to talk to doctors and patients. They're very well informed if you know the basics of oncology. It kind of produces trust that you're not just working with acupuncture. That's a central point. You need to know about the importance for Western doctors, the importance of research. And we do have research. And in the last 20 years, the amount of acupuncture research has been kind of exploding. And it does help doctors to see, okay, this is a research, might be small numbers, but it really happens something. So that's very important. Don't expect, I'm speaking mainly about Germany because I'm living and working in Germany, but I think it may be the same in other countries. If you want to start, it is good to have one doctor in the hospital who understands you, and that might be difficult to find. The other thing is nurses are really important in that system too. So it does help just to have a few nurses on an oncology ward who see the patients sometimes more often than the doctors, and to get them involved about the acupuncture oncology, because they go to patients saying, oh, I know a doctor who's doing that. So don't forget the nurses, to include them too. And you need a lot of patience. You need a lot of time and ongoing to have an integration in a big unit of something like acupuncture. I'm working in a hospital for 5 years, and I'm kind of continuously trying to bring it into the system, kind of not telling, just doing, like pericardium 6 or going to the palliative ward and treat symptoms and Shen. And you just have to keep continuing and don't get frustrated about it.
I met an oncologist, a Western oncologist in the UK last year,
Mm,
and I was interviewing him about the impact of acupuncture on his patients.
mm,
And he said that he didn't know how it worked, he didn't know why it worked, but
mm.
all
And
he knew is that it did work. And
absolutely.
the patients of his who saw an acupuncturist regularly, 10 treatments
Yeah,
over 10 weeks,
yeah.
they needed to see him less. They needed
Mm,
fewer medical interventions, and their outcomes seemed to be, on the whole, a lot better. And
yeah,
I loved hearing this, and that's one
yeah.
voice, one very loud voice, and that was
But
because.
still, probably it is one of these doctors who has an open mind to things like that. A lot of doctors don't even know that their patient's going to see an acupuncturist. So you just, and that's the reason I say not only think about doctors, but also think about nurses, because they see the patients more often and they actually see the difference if a patient has some treatment next to that,
Thank you.
next to Western medicine.
On a slightly larger scale, what can
Mm.
our organizations, what can our acupuncture associations be doing to try to encourage this this to happen?
One thing, as I said, is education, and show that the associations are very big in Germany about it, to see that their members are well qualified. And you need some. I'm not a politician. I'm really bad about that. I like to work and do, but it needs people who bring all these knowledge with research and things like that, and the education of their members into the hospitals. And it is different from country to country. Yeah. And I see it is in Germany, we have so many laws and things like that, it makes it more difficult. But again, the two main points are education and of their members, and then going with all this knowledge into the clinics and see, try to find doctors who are accepting it. And again, it's going to take a long time. I don't know how about England, but it is really difficult in smaller units in Germany.
Thank you. Now, finally, I would love to hear about you. You touched on it earlier on when you said that going into your first class of Chinese medicine
Yeah.
made you feel like you were coming home. What do you love about Chinese medicine?
Coming from a very yeah, Western medical situation, I love the principles of Chinese medicine for many reasons. One of the main reasons is so nature-based, and um, it's so fascinating how you can describe processes with all these beautiful principles. And one of the big principles I really love, not only with Qigong, but also in clinic, is the San Bao, the three treasures, because that's where we actually work on the patient. We do work on the Jing level, we work on the Qi level, we work on the Shen level. And when I look for points, I try to kind of get points at 3 levels. And in Western medicine, we kind of a lot more fixed on the Jing level of the body. It's changing. We do have a lot of lifestyle measures we know are important in Western medicine, but it's so beautiful in Chinese medicine. It is so rich and so full. And it is beautiful for our patients, because a lot of cancer patients have difficulties to understand why symptoms come up and why symptoms come up with them and not with other patients. And we have this beautiful language and this beautiful principle to help patients to better understand what's happening. And understanding is a basis for patients often to change things in their life. And this nature-based language is so much easier than Western medical language. And it's just beautiful. And we shouldn't forget about these principles. I often see acupuncturists kind of, or Heilpraktiker in German, kind of trying to see symptoms, and forget about these rich toolboxes, big toolbox we have in Chinese medicine to help the patient on all levels of the sunbao.
Beautiful. Dr. Julia Hartung, thank you so much for sharing your wisdom with us today. Thank you.
Thank you for the opportunity. I enjoyed it a lot.